welcome to this week's edition of the Magnate. Some people are of the opinion there is a particular organ in the human anatomy that is more important than others. Well, we know that all the organs are interconnected. Today, we shall be focusing on the specialist that takes care of that particular organ. And what organ are we talking about? This is the Magnate, mentoring on television, and then lending a voice to business growth. Today, we have a professor of medicine that will be extracting this important organ of the human anatomy. Let's give you the citation. When we come back, it will be an interactive session. We'll be back shortly.
Dr. Adeola Onakoya, a professor and consultant ophthalmologist, is a fellow of West African College of Surgeons and National Postgraduate Medical College of Nigeria. She specializes in the management of all aspects of glaucoma diagnosis and treatment. She also has expertise in diagnosis of neuro-ophthalmology disorders. Onakoya is skilled in the use of all types of medical, laser and surgical treatment of glaucoma. Her major research interest includes the role of systemic blood pressure and genetics in the disease process of glaucoma. She attended College of Medicine, University of Lagos between 1979 to 1984. She also had a residency training at Lagos University Teaching Hospital, Luth, between 1987 to 1992. Professor Onakoya also had 1-year training at Bristol Eye Hospital, Bristol, United Kingdom between January to December 1992. Dr. Adeola Onakoya has worked at College of Medicine, University of Lagos, Lagos University Teaching Hospital as a lecturer consultant ophthalmologist since 1995 and rose to the post of Professor of Ophthalmology. At different times, she served as Faculty Secretary of Ophthalmology of NPMCN, Secretary General of Ophthalmological Society of Nigeria, member ICO Advisory Leadership Group for Sub-Saharan Africa, Miyako representative at ICO Global Assembly. Dr. Onakoya is the immediate past head of Department of Ophthalmology, Lagos University Teaching Hospital. She's widely traveled, has over 80 publications in peer-reviewed journals, and has supervised over 70 dissertations. She's an active church worker and a deaconess, fully involved in ushering department at Redeemed Christian Church of God, also a member of the welfare group attending to the needy in the church. Professor Adeola Onakoya is happily married and blessed with wonderful children.
It's a great pleasure to welcome to the Magnate Professor Adeola Onakoya, consultant ophthalmologist, Lagos University Teaching Hospital, precisely Guinness Eye Center. You're welcome to the program, ma'am.
Thank you, Alaja. Thank you for having me here today.
You had the intro. How do you confirm or justify the fact that, okay, the eye is the most important organ in the human anatomy? How important is it?
Well, talking about the eye, we know that the eye is the organ of vision, and it's one of the 5 senses that we have. We have 5 sense organs. You have one for the touch, the one for taste, for smell, for hearing, and then for seeing. However, I would say that the eye is the most important. That's the one that gives the most impression of all the sense organs. And you ask me why. I tell you that the eye is the connection between our personal life and the environment. Just as the Bible says that the eye is the lamp of the body. It says if your eye is good, then the body is full of light. Also, if the eye is dark, then the body is full of, it says, evil. That's what the Bible says. But it's just to tell us that the eye plays a significant role in our interaction with the environment. We know that the brain is the center of the activity in the body. It's with your brain, the creativity comes from the brain, interactions, the spirituality, aspirations, all these come from the brain. But we can only do that when we interact with the environment. You need to see first, and then the brain goes into all this activity, and then you then do whatever you want to do, which is why I said the eye is the most important of the sense organ. In fact, about 80% of impression in human being is...
That's why I wanted to say, first impression matters. What does it really require to be an ophthalmologist? Before the program, we trying to X-ray. Before you, generally people go in for medicine. So immediately you graduate, does that make you an ophthalmologist?
No. Just as an ophthalmologist is a physician, is a medical doctor. So you've spent about 6 years in medical school, and that is straight medical school. If there are other issues, other barriers, as we have in the environment, might be 9 years, you know, that can lengthen the period. So it may not be exactly 6 years. So maybe after, let's say 6 years, for the purpose of the talk. And then you have 1 year of internship, that is 7. And then in Nigeria, the compulsory youth service, so that makes it 8 years. So after the 8 years, if you're lucky, then you start your training immediately. Because before you go on to the training, there are examinations you have to take, the primary exams. So if as a diligent and hardworking house officer, you're studying for the primary, you already know the specialty you want to, area you want to specialize. You start studying for that, and then you pass the primary exam, because if you don't pass that primary exam, you cannot commence the residency training. And the period of the residency is averagely about 5 years. So before you become an ophthalmologist. And 5 years is the minimum.
Just like 6 years minimum.
Yes, so 5 years. So if you add the 5 years to the 8 years, so it means beginning from the day you enter into medical school before you become an ophthalmologist, it's a period of averagely 13 years. Wow. So 13 years of schooling, 13 years of training. And after that 13 years, actually you have just started, because you have just specialized in the eyes. Now we have
different aspects,
sub-specialization. You know, you pick a part of the eye that you would specialize in. And my own part is glaucoma. So you see, that lengthy period is the reason why we say that an ophthalmologist is the head of the eye care team, because we spend so many years, and an ophthalmologist would take care of the medical condition, because we know that what we call systemic conditions, diseases affecting the body, manifest in the eyes. They can even manifest in the eye. Sometimes an ophthalmologist is the first person to detect some diseases in the body. And that is the reason why we also say that the eye is the window to the body. Some people will tell you that the eye is the window to your soul, because looking inside your eye, I can actually predict somebody can come down with stroke, cerebrovascular accidents in a period of 3 to 6 months, especially those who are hypertensive or people who have very high level of cholesterol and they do not know.
We're still chatting with Professor Adeola Onakoya, Professor of Medicine. I'm in the classroom. Maybe not certificate at the end of the day. It's a lot of health information download here. Let's go for a breather. When we come back, we'll continue with the conversation. Welcome back. We are focusing on the ophthalmology profession today. When last did you visit an ophthalmology? Do you know the condition of your eye? We have our prof in-house, Professor of Medicine, fellow of several associations. She is Professor Adeola Onakoya, consultant ophthalmologist, Guinness Eye Center, Louth. You're welcome back to the program.
Thank you, ma'am.
We've talked about, the profession, what you need to do. Somebody who is studying the general medicine now is still a bit confused as to what are those things she or she should be watching out for now in general practice or training.
Well, during training, there has to be an area that tickles that student's interest, because they go around all the departments, and whichever area they think that they will perform the best. For instance, when I was in medical school, there are 2 areas I knew that I wouldn't dare into, and that is pediatrics and obstetrics and gynecology.
Okay.
And for the simple reason that I said, it means you would not sleep, because if a woman is in labor, anytime you'll be called. I mean, it's part of the profession, to be on call, but not like the gynecologist. I mean, I admire them a lot, but I knew from the onset that I wouldn't go there. And I also would love to do surgery because I had the privilege of doing my youth service at Igbobi, orthopedic hospital. So there I developed my skill in surgery, and I then looked that which other area of surgery would give me less stress. And that was how I settled for ophthalmology, But the bottom line is for that student to look at that area where you have passion for. During the training, there are areas that you would love. For instance, I also loved cardiology, but after going to Igbobi, then the surgical aspect took precedence. So I then...
Are there differences in all these, so to say, professionals?
The ophthalmologist I have defined earlier on, that we are basically medical doctors, but we just specialized in the care of the eye. And it's total care we give, the medical, the surgical, and the optical. And the ophthalmologist is the head of the team. And we also treat medical conditions that are manifesting in the eye because we're able to make that diagnosis. So we go to medical school. Now the optometrists, they are also eye care provider, but they are not medical doctors. They do not go to medical school. All they studied, they studied for 5 years in the university. In Nigeria, for instance, they get Doctor of Optometry, that's DO. But most of them are addressed as doctors, but they are not medical doctors. And what they do is to examine the eye, to assess the eye, how much you can see, which is a visual acuity. And if you're not seeing well, they run some tests, for glasses. They do refraction. They prescribe the glasses, the power of the glasses that you would wear. And that is then sent to the optician. Now, the optometrist, in addition to assessing your eye for the power of glasses that you would require, they can also teach you eye exercises for children who have crossed eyes. We also have within that group the orthoptists, who, those ones will teach you eye exercises, so many other things.
Interestingly, some people are born with some genetic or congenital eye issues.
Yes.
What do you have to say about this?
Well,
and they may not know.
Saying that I do not like pediatrics is the pediatrics as a specialization. But in ophthalmology, we have a sub-specialization known as pediatric ophthalmology, because the child's eye is not the same as the adult eye. Just as people will tell you that children are not the same, they are not half adult. So because of that, we have pediatric ophthalmologists. However, there are so many conditions that may affect the eye of the unborn child. And the number one reason why a child will have an eye condition, even in utero, in the uterus, is these are conditions that affect the mother, especially during pregnancy. For instance, if we have a mother that is ill, particularly in the first trimester, the first 12 weeks of pregnancy, it would affect the eyes. But it's not just the eyes, it will affect other parts of the body. So that child may be born with eye conditions such as cataract, glaucoma, or even may have some deformities on the face. But in addition, that child may also have heart deformity, may affect other parts of the body, may have very big head that we refer to as hydrocephalus, or the eye or the head may be very small, which is known as microcephaly. Another reason why a child may also develop eye condition is genetic, may have inherited it either from the father or the mother, maybe something in their generation, and such a child may come down with such condition. Like we can have children with cataract, like I said, and then what is called congenital glaucoma and other conditions. Or even the child is born, you see that the two eyes are white. You cannot distinguish the white of the eye from the transparent part of the eye. So such children, it may be because of what they have inherited from both parents. Or it may be because the mother wasn't ill, but probably mother took some medication during pregnancy, especially steroids. Apart from, pregnant women are advised to take only medications
Prescribed.
that the doctors prescribe, you know, like the multivitamins. But if you have to take other medication, you should check with your doctors first. And the doctor will have to weigh the benefits against the risk of you taking that medication. And another reason is exposure during pregnancy. Pregnant mothers that are exposed to radiation, maybe for some other reason, mother is ill, needs to take x-rays, needs to take CTs, you know, or radiotherapy, you know, all this may result into abnormality in the child that is unborn. And part of the abnormality may be in the eyes.
We see that even young people are now coming down with a lot of eye diseases. Who's responsible for this and how conscious are they?
Well, awareness of eye condition is low, I would say low, in this environment. And the reason is very simple. You know, in the developed countries, they have stage examination for people generally. Like children from the age of 3, they do preschool eye screening, and then they do school eye screening. Though in Lagos State now, I can see Lagos State government doing school eye screening. So when they do all this, you know, they know certain conditions that they have, which must be addressed. But in this environment, you know, that is very low. And the other reason why people do not come to the eye hospital or they go blind before they know is there are only 3 reasons that will drag people to the hospital. It's when they are not seeing, at least that is our experience here. People who have loss of vision, or people whose eyes are red, or people whose eyes are painful. And until people experience these 3 situations, they would not come to see the doctor. But that should not be the case, because there are eye conditions that will not give you any symptoms, none of those. And that eye condition is the one I specialize in, which is glaucoma. And unfortunately, for people who have glaucoma, you know, that is bad. Bad in the sense that glaucoma itself is asymptomatic at the very early stage. And by the time you don't have symptoms, none of those 3 symptoms I mentioned, loss of vision, redness, or pain. And because of this, by the time the people who have glaucoma come into the hospital, they have already lost useful vision. Because unfortunately in glaucoma, once you have lost vision from it, you cannot recover that vision, because it's a disease that affects the nerve. Yes, cataract is just a cloudiness of the lens. And the way cataract is dealt with is we just wash out that lens that is cloudy and replace it with an artificial lens, and patient recovers vision. But the visual loss in glaucoma is irreversible, because it is the nerve that connects the eye to the brain, that is damaged in glaucoma. So you can imagine the eye is opened, you know, you're looking at things in the environment, the visual processing takes place in the eye, but it's then not passed on to the brain because there is a disconnect between the eyeball and the brain.
You say it's irreversible. By the time you detect it early,
yes,
can it be corrected not to progress to the irreversible stage?
Now, unfortunately, glaucoma is a disease that is progressive, whether you are treating it or you're not treating it. The only difference between somebody who is being treated and that person who is not being treated is the period it will take before one goes blind. Wow. However, if it is attended to, if it is detected at the very early stage and treatment is instituted, that may prevent blindness. Yes. So all we can do in glaucoma is to prevent blindness. But it cannot be cured because the cause is not known. We only have risk factors. Factors that we would say, if you fall into this group, you may have glaucoma. Like if you are black, advancing age, yes, family history. And if the pressure in the eye is high, yes. And then there are other reasons. If you're short-sighted, if you're using steroid, you know, if you have trauma to the eye, and then people who have family history, as you alluded to, or people who are using steroids, steroid in any form, steroid tablet, steroid injection, steroid cream, like the one we rub on the body, bleaching creams, yes. And then people who are asthmatic, who are using steroid inhaler.
Okay.
All these people can come down with glaucoma and even cataract.
Thank you so much. Now, earlier on, we alluded to the number of years that you spend being a professional, a consultant ophthalmology. What do you have to say about practice in our environment that is, so to say, leading to high level of brain drain?
That is a very touchy area now. And the reason, at the bottom of it is the economic downturn, the high inflation. You know, we all go to the same market. A doctor that has children in school, professional, you cannot even afford with what you're being paid. You cannot afford to send your children to school. And if people have to leave for that reason, there's nothing we can do. I mean, they have to leave, they have families to look after. And I think government really has to sit back and look at what is to be done. It's because the professionals are poorly paid. I mean, I was discussing with a colleague this morning. She said she's considering relocating. And that is after a colleague of mine. I mean, I started ophthalmology like 35 years ago, you know, the profession. And somebody who has been in this profession of ophthalmology for 35 years and wanting to relocate from Nigeria because of the economic downturn.
Well, you see, as much as we're not going to apportion any blame,
yes,
you have endured.
Yes.
Probably with a passion.
Yes, with a passion, but you don't know what my next steps are.
No, don't dissuade us now. Because since you have endured, I've known you for over 20 years, and you're still here. I could come in here, knock on the door, and you will say, so I want you to sort of encourage. It's not all gloomy. We can still all sit down to encourage, to, you know, build the nation. It's not just in the medical practice that we're having issues.
Yes.
The economy is global.
Yes, it is.
Since the COVID, you know, that is
yes,
winding down now. It has affected virtually, you know, facets of life.
Yes, no doubt. Yes, ma'am. No doubt it's global. However, the Nigerian situation is peculiar. So that is not to say that all of us should just leave the country. Some of us would have to stay back to look after people. I can tell you that if things improve, some people would actually come back because there's no place like home. No place like home. You would have read of people who relocated and they are regretting. They are saying, oh, the tax in this country is a lot. Because a lot of them in Nigeria, they don't even pay tax. If they pay, you know, peanuts, you know.
You also alluded to what I had in mind, you know, the pressure that a few of you left have to face.
Yes.
Because it's a referral hospital.
Yes.
You get a lot of people, and then to a large extent, this even puts pressure on the few practitioners, and they get a bit touchy and a little bit aggressive, you know. What's maybe just a counsel for both the patients and your colleagues in the industry?
Yes, the first would be that they have to be patient. Patience is the word. When you get to the hospital, and, you know, some patients will come and tell you, I've been waiting here for 3 hours, I've been waiting for 4 hours.
Some
but
people even sleep over.
Yes, but have you found out how many doctors you have in there attending to you? Of course, we have a lot of shortages. Even now, we have fewer doctors to train. In the residency program, I can tell you, you know, for the entrance exam that we did the last time, in our department, we had 10 people that were to resume. But out of the 10, maybe only about 3 or 4 people were available. The others have left. They said they were no longer interested because they've gone to sit exams for UK, US, and they prefer to go abroad. So patients have to exercise patience. Like one patient told me yesterday, he said, now I know what it means to be a patient, you know. So they have to exercise patience, you know, with the doctors. And doctors, we are also trying as much as possible, and other stakeholders, you know, the nurses and all other hospital workers, you know, because it's like you rightly said, it's not even only in medical profession. We have people relocating in other industries. But because our own is peculiar, you know, people would always come to the hospital, people would always fall ill. But I would then advise people also to try and live well so that you won't have to end up in the hospital. Eat well, eat vegetables, you know, eat good food, so that you won't. Good food not necessarily mean expensive food.
Good
You know,
habit and lifestyle.
and lifestyle, exercise, drink a lot of water. Forget about all the sodas, okay? So that you won't end up in the hospital, you won't develop hypertension, you won't develop diabetes, so you can live well.
Professor Adeola Onakoya, teacher of teachers, doctor of doctors, doctor of professors. Thank you very much.
It's my pleasure.
For this health education and
Thank
information
you.
overload.
Thank you, ma'am.
Has been a magnet for you. I'm sure you've taken a lot from this program, mentoring on television and lending a voice to business growth. Remember, you can rewatch this program on our YouTube channel, Ames Media Company. And then, of course, follow us on our social media handles. Let's do it again, same time next week, when we shall bring an equally articulate and cerebral magnate on the program. Until then, bye for now.